Hi, I'm Dr. Rita Kathawa, bariatric medicine specialist and founder of Michigan Weight Loss Institute.
And I'm Dr. Marissa Baca, a board-certified plastic surgeon at the Straith Clinic. And this is A New You by Us Too.
Today, we're here to continue to bring you the latest and newest information when it comes to treatment for weight and obesity issues and body contouring as well.
Yes. So today we're going to talk a little bit more about preparation for surgery, kind of leading up to body contouring surgery. What things do you have to take into account? And so for some patients, maybe you are on medical therapy to help with your weight loss journey, and maybe you're still on it for maintenance. So a lot of times we get asked questions, when do I need to hold my medications? How do I need to alter my medications leading up to my body contouring surgery?
Yeah, there's a lot of questions about when certain classes of medications can be held, and it's really age independent. Some just a couple days, some you don't need to hold, some you need to hold for 1 week, some a little bit longer depending on your medical history. So that's something that we usually work closely on, trying to figure out, to get you prepared for surgery.
Right. And on the surgical side, a lot of it comes down to anesthesia and how it can impact anesthesia. So that's where a lot of our safety concerns come in with that. And I know what patients express to me, at least, when we're talking about that process. Okay, we're going to hold your medications a couple weeks before and after, for example. Some of them get nervous. Yeah. They think, okay, am I going to gain all the way back in a couple weeks? So how do you coach them through that?
Usually I see them 1 week after surgery, 1 to 2 weeks after surgery. Once they're a little bit more mobile, they're kind of beyond the acute post-op recovery phase. And we take a number of things into consideration. But once they're not using their pain medicine as much, not having a ton of, and if they're not having side effects, of course, we can start their medications a little bit sooner. Sure. But yeah, we usually get them back to their therapy pretty quickly. Yeah, we really don't have, there's always surgical risk, but we really don't see a ton of complications. And in a few cases, we work with them. So we always try to get you back to your pre-surgical regimen.
Right. Yeah. And, one of those other advantages of working with a bariatric medicine specialist is you have someone there with you, right? So you're off the medications for maybe a couple weeks around the time of surgery, but you're not isolated. You're not on an island by yourself. You have your specialist so that if you have concerns about that time and how you might be changing your activities or your lifestyle to make sure that you don't have any, sudden weight gain within that period of time, you have someone to go to.
Definitely. And you bring up a good point about avoiding weight fluctuations and weight gain now that you've achieved a beautiful surgical result. How do we maintain it?
Yeah. Excellent. Well, and I think that ends up even being a two-part question. So we need to be at a good, stable weight before surgery, and how do we maintain it? And sometimes the maintaining goes back to what is our stable weight before surgery. So, obviously you want to be focused on what your medical goals are, your body composition goals. And then once you reach that, if you are an appropriate candidate for body contouring surgery, that's when we kind of proceed forward with some of that. But I think part of deciding on what that goal weight before surgery is back to what you said originally about realistic expectations. What's a weight that you can maintain long term? Because the key is maintenance and avoiding those fluctuations. And if, let's say you can get down another 10 pounds, but you're really starving yourself and you're not doing it in a healthy, sustainable way, that's not helpful for you because you're not going to be able to maintain that after. So arriving at a good weight before surgery that kind of checks off all your medical boxes, makes you a good candidate for surgery, that's probably the sweet spot. And ideally, you like to be there for several months before we do body contouring surgery, because sometimes that gives you the time to find that out. You might find out, I'm still losing weight. I'm still in the process of losing weight. Or, this is a tough weight for me to maintain. So that period of stability for a few months before we encounter body contouring surgery, I think kind of gives yourself a little test of what feels right for your body.
Important.
That's so important, so important.
important. Is there anything that the patient can do to minimize their surgical risk?
Yeah, so I think a lot of the lifestyle things that we are looking at in general, how do we live a healthier life, can only help you in surgery. So the main things are stopping smoking. And, obviously smoking, or not smoking, I should say, has so many health benefits for you. But on a surgical level and on a tissue recovery level, the main thing is smoking decreases the blood supply to tissue. So it vasoconstricts. It gives less of the nutrients and blood to the tissues that need healing. So that's where we can see wound healing problems, tissue necrosis, things like that. So stopping smoking forever is the best, but at least for me personally, it's 6 weeks before and after surgery. And that includes avoiding any nicotine-containing products. So the patch, the gum, things like that, because that nicotine is still going to cause that vasoconstrictive, that tightening of the blood vessels that's going to impact wound healing. So making sure that you're not smoking and not using any nicotine products for at least 6 weeks before and after surgery is key. And then a balanced diet. I think that's something that can be difficult, especially with patients who are going through a weight loss routine, or maybe who have had bariatric surgery, where their absorption, their mineral and nutrient absorption may not be the same. So making sure that you're getting all of those essential nutrients and minerals, making sure that you're getting a good amount of protein in your body.
Important, once again.
Yes,
Protein.
yes, because that's going to help your body in its ability to heal after. I think those are some of the main things. And then, also looking at what other disease factors that you have. Do you have diabetes? Do you have high blood pressure? Do you have thyroid disease? And are those things well controlled? Because if they're a little bit out of control, that's probably not the best time for you to have surgery. We want to make sure all of those are in the best element so that you, as a patient, have the best opportunity to heal.
So, weight stability, minimizing use of nicotine, and certainly cessation at least 6 weeks before having surgery. Working with your other team members and physicians involved to figure out which medications can be held. And of course, getting in a proper healthy diet, high in protein, and exercising is also important.
All those things are going to be helpful for surgery, absolutely. And
Thank you for that
then
information.
also feeling like it's the right time for you in your life, with your family. Surgery is stressful. The recovery is stressful. You'll need help. Other members in your family will need to help you, or help. If you have little kids, you need someone to help with them. And so finding the time that it fits best into your schedule can be a big relief to many patients. So if it's, it's a time when my job isn't so busy, so that's less stress on me, that's great. Or it's a time when I know I have family members to come in and help and be available to watch my young children, that's helpful. So not discounting those other kind of life factors that can impact how the recovery process is for you. I think that planning can be so essential.
So how much downtime are we looking at?
So it really depends, surgery by surgery. And a common question I get asked is, how long will I be healed? And it depends. The swelling's going to go down in a couple weeks, a couple months, but it's still going to be there for maybe 3 to 6 months. Your scars are going to be healing for 1 to 2 years or more. But probably the more immediate question has to do with activity restrictions. So most of my patients are on activity restrictions for at least 3 weeks. So no heavy lifting over 5 pounds, no exercise that's increasing heart rate or blood pressure, and then certain body contouring procedures like tummy tuck. Usually we have you on some core restrictions for about 2 months. And, certain procedures are a little bit easier to recover from. Breast surgery is a little bit less tender for most patients, and they're more mobile quicker. Other surgeries that are involving more of your trunk might be a little bit more difficult to get around, move around quicker. So then maybe you're really not trying to return to some of those exercise things till more like 4 to 6 weeks or so. So it just kind of depends. But another reason why sometimes it's helpful to get in for your consultation earlier than when you're really planning on having surgery, so that you can kind of hear some of those specifics, and so that you can help plan that surgical time to be a time that fits into your life in the best way.
And you mentioned earlier that certain areas could be combined and certain areas cannot be combined. And that probably has something to do with how quickly you can recover and what the recovery would look like.
Totally,
right?
totally. And one of the examples I like to use is, I personally don't like to combine arm lift surgery with thigh lift surgery, because then you have both your arms and your legs have had surgery, they're feeling sore. Well, how do you get up out of the chair if all 4 of your limbs hurt? So it's just a little bit more difficult to do those types of things. So we want to kind of think about, okay, practically speaking, you're at home, you're trying to get up from your chair, you're trying to go to the bathroom, you're trying to sit down in your bed. How can we kind of combine surgeries to make that the most feasible for you? So that's got a lot to do with it too.
And that's one thing I love about your work is you don't just prescribe all the surgeries that a patient would need. You customize, and in a way you are conservative, what's absolutely necessary, and that's something that patients really appreciate as well, and they do notice. So.
I appreciate that. Well, and I just try to think about myself or a loved one in that situation and think, okay, how could I make it easier for them to kind of go through this recovery process? Because it's a lot, it's a long journey. The surgery itself can be a lot. The recovery can be a lot. So we want to make it as easy as possible for you.
But so worth it.
So worth it. Yes.
Yes. They'll tell you after coming back, once they're back to normal, who really regrets it? I mean, once they're past that, they're always so happy and thankful that they did it.
Yeah. But you want to be as prepared as possible for the interim where you're feeling sore.
Absolutely. Thank you so much for the wealth of information. Really helpful here. Thank you.
So I hope you guys learned a little bit more about how to prepare for your surgery. Remember to check out our websites and social media for episodes to come, and for more information on past episodes as well. And you can always reach out to us. Thank you.